Mr. Hunt said the key was to treat more people at home and in the community to ease the burden on hard-pressed hospitals. Well, some people would say that's part of the problem. Well, let's talk to Stephen Dorrell, former Health Secretary and Chair of the NHS Confederation. Stephen, good afternoon.
Good afternoon to you.
Is this a welcome admission from Jeremy Hunt? It's slightly surprising in some ways, isn't it?
Well, yes, I think it is slightly surprising, but I commend him, actually, for recognising the scale of the issue. If you're going to change something, the first thing you have to do is to recognise the need for change. The Secretary of State has obviously done that. But what people will then be looking for is recognising that there's unacceptable service in parts of the health and care system, patients, citizens who rely on the system look for from the government is obviously not a running commentary. It's evidence, but having recognised the scale of the issue, something will then be done about it.
But this is not a sudden issue that's arisen, is it? It could have been foreseen months ago. When Jeremy Hunt says the key is to treat more people at home and in the community, I wonder whether you think he's right on that.
Well, I do think he's right to the extent that the health service cannot deliver the health care, the acute and urgent health care that many people need, if it at the same time is trying to deliver more routine social care that actually shouldn't be the business of the National Health Service. And that's why Simon Stevens, the chief executive of NHS England, has been saying, actually for years now, that the only way the NHS can realistically expect to deliver the service we all want to see from the hospital service and primary care and the different parts of the health service is if it's seen to be part of a fully financed set of public services, including social care, including social housing, and seeing the health service divorced from the rest of local public services is the wrong way of looking at it. That's not. It's unusual, frankly, for the senior figure in one public service to say the priority is to increase the funding available to another part of the public service. But that's what Mr. Stevens said last summer. He said it loudly last summer and has been saying it loudly ever since.
When you look at other countries, Jeremy Hunt points out that France has been struggling this winter with flu, while some German cities have been forced to close their A&Es. So, I mean, I don't know whether he's using that to defend the fact that we've had such problems here. But are there, I mean, as chair of the NHS Confederation, are there things that we can learn from the way that people run their health services in other European countries?
Well, it's absolutely right to say that the issues of rising demand and the issues related to our success, actually, at people being able to live longer. We all look forward to a longer life. That does create issues, of course it does, for the full range of public services, and that's happening not just in the UK, but happening all over the world. Are there lessons that can be learned? Yes, absolutely there are lessons that can be learned, and one of them is the point that I think Jeremy Hunt is right to say, actually, you can't solve the problems of hospitals if you see hospitals, as I sometimes say, as cities on the hill. They have to be part of a fabric of public service within a community. That's the lesson from all over the world, from America to Japan and elsewhere in Europe as well.
Stephen, thank you. That's Stephen Dorrell, Chair of the NHS Confederation. 4:56. Let's go back to your calls on arms sales to Saudi Arabia. Jordan is in Watford. Hello, Jordan.
Hello, Ian. Nice to be in the show.
Nice to have you. What would you like to say?
I just want to say, from a moral point of view, 2 points quickly. From a moral point of view, I don't think we should sell arms just because if it's contributing to wars in other countries, and especially if we're against that, we shouldn't do it. But from the other side of things, I don't actually know where the money goes in terms of the budget for Britain. So I think if it was scrutinised a bit more and we as a public were to know, I really don't know if I could say for sure that I wouldn't want arms to be sold. I knew it would impinge my own quality of living. I know it seems a bit selfish, but